Imagine sitting down to a hearty breakfast of juicy pork sausages. You savor the taste, unaware of the potential danger lurking within. What you don't see could harm you. Undercooked pork can harbor a hidden threat, larvae of a parasitic tapeworm called Taenia solium. These tiny invaders can cause a serious condition called cysticercosis. This often overlooked danger highlights the critical importance of proper food safety practices. Join me as we delve into the unsettling reality of what can happen when these parasites invade the human body. Dr. Sam Ghali, a renowned neurologist, encountered a case that changed his perspective on foodborne illnesses. A young patient arrived, complaining of headaches, blurred vision, and seizures. These symptoms pointed towards a serious neurological condition. Dr. Ghali ordered a brain scan, expecting common neurological issues. The scan revealed numerous small white cysts, a parasitic invasion. The diagnosis was cysticercosis caused by the pork tapeworm, Taenia solium. This case ignited a passion in Dr. Ghali to raise awareness about food safety. The culprit behind this disturbing condition is a parasitic tapeworm known as Taenia solium, commonly referred to as the pork tapeworm. This parasite has a complex life cycle involving both pigs and humans. Pigs ingest food or water contaminated with human feces containing tapeworm eggs. The eggs hatch in the pig's intestines, and the larvae penetrate the intestinal wall. They travel through the bloodstream and burrow into the pig's muscles, forming cysts. Humans become infected by consuming raw or undercooked pork containing these cysts. The tapeworm larva attaches to the human intestine and matures, producing thousands of eggs. The most concerning aspect is its ability to cause cysticercosis in humans. Cysticercosis is a parasitic tissue infection caused by the larval cysts of the pork tapeworm, Taenia solium. These cysts can develop in various parts of the body, including muscles, the eyes, and most concerningly, the brain. The severity of the infection depends on the location and number of cysts present. When Taenia solium eggs are ingested, they hatch in the intestines and release larvae. These larvae penetrate the intestinal wall and migrate through the bloodstream to different tissues and organs. Once they reach a suitable location, they develop into cysts, which can persist for years. The presence of these cysts triggers an inflammatory response from the body's immune system. This immune response can cause a range of symptoms depending on the location of the cysts. Symptoms are often mild initially, but can become more severe as the cysts grow and the immune response intensifies. Cysticercosis is often asymptomatic in the early stages. As the infection progresses, symptoms vary depending on the location and size of the cysts and the body's immune response. The most serious complication of cysticercosis arises when these cysts lodge themselves in the brain, a condition known as neurocysticercosis. The brain, being a delicate and vital organ, is particularly vulnerable to the damaging effects of these parasitic invaders. As cysts develop in the brain, they trigger inflammation and swelling, disrupting normal brain function. This disruption manifests in a range of neurological symptoms, the severity of which depends on the size, location, and number of cysts. Headaches are one of the most common symptoms of neurocysticercosis, often persistent and debilitating. Seizures, another common symptom, occur when cysts interfere with the brain's electrical activity, leading to uncontrolled bursts of electrical signals. Neurocysticercosis can lead to long-term neurological problems if left untreated. These can include chronic headaches, persistent seizures, cognitive impairment, and even life-threatening brain swelling. Cysticercosis is not merely a localized health concern. It casts a wide net, impacting people across the globe. While prevalent in developing countries, it also occurs in developed nations, often going undiagnosed or misdiagnosed. The World Health Organization recognizes cysticercosis as a leading cause of preventable epilepsy worldwide. This parasitic infection is particularly endemic in regions of Latin America, sub-Saharan Africa, and Asia, where poverty, poor sanitation, and free-ranging pigs are common. In these areas, the risk of exposure to Taenia solium eggs is significantly higher due to inadequate hygiene practices and limited access to clean water and sanitation. The impact of cysticercosis extends beyond individual health, placing a significant burden on healthcare systems in endemic regions. The costs associated with diagnosis, treatment, and management of the condition, particularly neurocysticercosis, are substantial. Addressing this global health challenge requires a multi-pronged approach, encompassing improved sanitation, access to clean water, food safety education, and effective public health interventions. In the heart of Brazil, a young woman named Maria experienced the devastating consequences of cysticercosis firsthand. Living in a rural community with limited access to clean water and sanitation, Maria had unknowingly consumed contaminated food, setting off a chain of events that would forever alter her life. Initially, Maria experienced mild symptoms, occasional headaches and fatigue, which she attributed to her demanding work on the farm. However, as the parasitic cysts grew in her brain, her symptoms worsened. The headaches became unbearable, and she began experiencing seizures, causing her to collapse in the fields. Fearful and confused, Maria sought medical help. After a series of tests and scans, the diagnosis came as a shock: neurocysticercosis. The news hit Maria hard. The once vibrant and healthy young woman now faced an uncertain future, grappling with the realization that a parasitic infection had invaded her brain. Maria's story serves as a stark reminder of the human toll of cysticercosis, highlighting the urgent need for increased awareness, improved sanitation, and access to safe food and water, particularly in vulnerable communities worldwide. The power of prevention. Hygiene is key. Preventing cysticercosis starts with understanding its transmission route and adopting simple yet effective hygiene practices. By breaking the cycle of infection, we can protect ourselves and our communities from this preventable parasitic disease. Proper hand washing stands as the first line of defense. Washing hands thoroughly with soap and water after using the toilet, handling raw meat, and before eating or preparing food is crucial in preventing the spread of Taenia Solium eggs. Maintaining good personal hygiene extends beyond hand washing. It includes washing fruits and vegetables thoroughly, especially those eaten raw, and ensuring that drinking water is safe and free from contamination. In areas with limited access to safe water, boiling water before consumption can effectively kill any harmful bacteria or parasites. These simple hygiene practices act as powerful shields against cysticercosis, safeguarding our health and well-being. Cooking your food thoroughly. When it comes to pork, proper cooking is non-negotiable. The heat from cooking destroys the parasitic cysts, rendering the meat safe for consumption. Therefore, cooking pork thoroughly to an internal temperature of at least 145 degrees Fahrenheit or 63 degrees Celsius, as recommended by food safety guidelines, is crucial in eliminating the risk of infection. Investing in a meat thermometer provides an added layer of assurance, allowing you to accurately gauge the internal temperature of the meat and ensure it has reached the safe zone for consumption. Avoid relying solely on visual cues, as color can be deceiving, and undercooked pork may still appear pink. Remember, taking shortcuts with pork preparation is not worth the risk. By prioritizing thorough cooking, we can savor our favorite pork dishes without compromising our health. Safe food handling practices. Safe food handling practices are fundamental in preventing cysticercosis and other foodborne illnesses. When preparing meals, it's essential to maintain a clean and hygienic environment to minimize the risk of cross-contamination. Start by washing your hands thoroughly with soap and water before and after handling raw meat. Use separate cutting boards and utensils for raw meat and other ingredients to prevent the transfer of harmful bacteria or parasites. When storing food, keep raw meat separate from other foods, preferably in sealed containers or bags on the bottom shelf of the refrigerator to prevent any dripping onto other items. After preparing raw meat, wash all surfaces, utensils, and cutting boards with hot, soapy water. By adhering to these safe food handling practices, we can create a safer and healthier kitchen environment for ourselves and our loved ones. A call for awareness and action. Cysticercosis is a preventable parasitic infection that continues to pose a significant public health threat, particularly in developing countries. Raising awareness about this often neglected disease is crucial in promoting prevention and control efforts. We must educate ourselves and our communities about the dangers of consuming undercooked pork, the importance of proper hygiene practices, and the need for safe food and water. Healthcare professionals play a vital role in diagnosing and treating cysticercosis, and their awareness of the condition is essential for timely intervention. Governments and public health organizations must prioritize initiatives that promote safe food handling practices, improve sanitation, and provide access to clean water, particularly in vulnerable communities. By working together, we can break the cycle of infection and reduce the burden of this preventable disease. Let's spread the word, advocate for change, and work towards a future where cysticercosis is no longer